Now we're going to go on to traumatic brain injury, TBI. Traumatic brain injury, TBI. Traumatic brain injury, TBI. Disruption of brain function due to trauma. Penetrating an object pierces the skull, or non-penetrating closed head injury. Signs and symptoms: irritability, confusion, decreased level of consciousness. Irritability, confusion, decreased level of consciousness. Irritability, confusion, decreased level of consciousness. Headache, headache, headache. Cushing's triad, Cushing's triad, Cushing's triad. Widened blood pressure, widened pulse pressure, widened pulse pressure, not blood pressure. Cushing's triad, widened pulse pressure. Cushing's triad, widened pulse pressure. Bradycardia, irregular breathing. Bradycardia, irregular breathing. Bradycardia, irregular breathing. These are important pieces. Decreased level of consciousness. Decreased level of consciousness. Decreased level of consciousness. Pupil abnormalities. Pupil abnormalities. Pupil abnormalities. Nausea and vomiting. Nausea and vomiting. Nausea and vomiting. Seizures. 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 Abnormal posturing. Abnormal posturing. Abnormal posturing. Ataxia. 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 Muscle weakness. Muscle weakness. Muscle weakness. CSF leakage and from nose to air. CSF leakage from nose and air. CSF leakage from nose and air. Halo sign on dressing. Halo sign on dressing. Halo sign on dressing. Battle sign. Battle sign. Battle sign. Periorbital ecchymosis. Periorbital ecchymosis. Periorbital ecchymosis. Periorbital ecchymosis. Nursing considerations for TBI. This is important. Stabilize the cervical spine. Stabilize the cervical spine. Stabilize the cervical spine. Maintain patent airway. Maintain patent airway. Maintain patent airway. Monitor vital signs, level of consciousness, EKG. Monitor vital signs, level of consciousness, EKG. Monitor vital signs, level of consciousness, EKG. Prevent increase in ICP, intracranial pressure. Prevent increase in intracranial pressure, ICP. Prevent increase in ICP. Reduce hypercapnia, which is hyperventilate the patient. Reduce hypercapnia. Reduce hypercapnia. Avoid suctioning. Avoid suctioning. Avoid suctioning. Keep head of bed to 30 degrees and head midline. Keep head of bed to 30 degrees and head midline. Keep head of bed to 30 degrees and head midline. Patient teaching. Avoid coughing and blowing nose. Patient teaching. Avoid coughing and blowing nose. Patient teaching. Avoid coughing and blowing nose. Extreme neck flexion extension. Extreme neck flexion extension. Extreme neck flexion extension. Restrictive clothing. Restrictive clothing. Restrictive clothing. We're going to go back to TBI complications. There's some more that I wanted to throw in here for you. For brain herniation, brain herniation, brain herniation. Downward movement of brain tissue due to cerebral edema. The signs and symptoms for brain herniation is fixed dilated pupils. Fixed dilated pupils. Fixed dilated pupils. Decrease level of consciousness. Decrease levels of consciousness. Decrease levels of consciousness. Abnormal respirations and posturing. Abnormal respirations and posturing. Abnormal respirations and posturing. For hemorrhage and hematoma. Epidural hematoma. Atrial bleeding into the space between the skull and dura mater. This is very important. For epidural hematoma, it is atrial bleeding into the space between the skull and dura mater. For epidural hematoma, it is the atrial or arterial bleeding into the space between the skull and dura mater. Subdural hematoma, venous bleeding into the space between the dura mater and the arachnoid mater. Subdural hematoma, venous bleeding into the space between the dura mater and arachnoid mater. Subdural hematoma, venous bleeding into the space between the dura mater and arachnoid mater. Intracerebral hemorrhage, accumulation of blood within the brain tissue. Intracerebral hemorrhage, accumulation of blood within the brain tissue. Intracerebral hemorrhage, accumulation of blood within the brain tissue. Hydrocephalus, it's a buildup of fluid in the brain due to impaired reabsorption of CSF or an issue with CSF outflow. It's a buildup of fluid in the brain due to impaired reabsorption of CSF or an issue with CSF flow. It's a buildup of fluid in the brain due to impaired reabsorption of CSF or an issue with CSF outflow. So remember, it's CSF. Others. These are all under complications for TBI, okay? Others. Diabetes insipidus. Diabetes insipidus. Diabetes insipidus. SIADH. 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 Cerebral salt wasting syndrome. Cerebral salt wasting syndrome. Cerebral salt wasting syndromes. So we just kind of went back and did the complications for TBI. We want to make sure you have that. We're going to now go on to cataracts, which is lens opacity impairing vision. Lens opacity impairing vision. Lens opacity impairing vision. Risk factors, aging and family history. Aging and family history. Aging and family history. Systemic diseases, diabetes and trauma. 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 Signs and symptoms, gradual painless loss of vision. Gradual painless loss of vision. Gradual painless loss of vision. Blurred and double vision. Blurred and double vision. Blurred and double vision. That is important. Blurred and double vision. Sensitivity to glare, halo around lights. Sensitivity to glare, halos around lights. Sensitivity to glare, halos around lights. White gray pupil. White gray pupil. White gray pupil. Absent red reflex. Absent red reflex. Absent red reflex. So here's a cool chicken tip from Level Up RN. Cataracts equal cloudy lens, cloudy vision. Cataracts equals cloudy lens, cloudy vision. What you're going to do for post-op patient teaching: apply eye drops as prescribed, wear sunglasses. Apply eye drops as prescribed, wear sunglasses. Apply eye drops as prescribed, wear sunglasses. Avoid increase IOP. Avoid increase IOP. Avoid increase IOP. Don't bend at waist. Don't bend at waist. Don't bend at waist. Avoid sneezing, coughing, blowing nose. Avoid sneezing, coughing, blowing nose. Avoid sneezing, coughing, blowing nose. Avoid lifting over 10 pounds. Avoid lifting over 10 pounds. Avoid lifting over 10 pounds. Tight collars. Tight collars. Tight collars. Straining with bowel movements. Straining with bowel movements. Straining with bowel movements. Best vision occurs 4 to 6 weeks after surgery. Best vision occurs 4 to 6 weeks after surgery. Best vision occurs 4 to 6 weeks after surgery. We're now going to go on to glaucoma, which is an eye disorder that causes increased IOP and damage to the optic nerve. Now, there's two glaucomas. There's open angle and then there's closed angle. Open angle is most common. Aqueous humor overproduction. Aqueous humor overproduction. Aqueous humor overproduction. Low outflow results in gradual increase in IOP. Low outflow results in a gradual increase in IOP. Low outflow results in a gradual increase in IOP. Then you have closed angle, and that's less common. And it's forward displacement of the iris. Forward displacement of the iris. Forward displacement of the iris, which obstructs aqueous humor to outflow completely. Obstructs aqueous humor to outflow completely. Obstructs aqueous humor outflow completely. A sudden increase in IOP. A sudden increase in IOP. A sudden increase in IOP, and that's closed angle. For risk factors: aging, genetics, aging, genetics, aging, genetics. For race and ethnicity: African or Asian, African or Asian, African or Asian. Diabetes, hypertension, diabetes, hypertension, diabetes, hypertension. Signs and symptoms of open angle glaucoma. Signs and symptoms of open angle glaucoma. Loss of peripheral vision. Loss of peripheral vision. Loss of peripheral vision. Mild aching in the eyes. Mild aching in the eyes. Mild aching in the eyes. Headache. 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 Signs and symptoms for closed angle glaucoma. Severe eye pain. This is important. Severe eye pain. Severe eye pain. This is for closed angle. Severe headache, nausea, and vomiting. Severe headache, nausea, and vomiting. Severe headache, nausea, and vomiting. Blurred vision. Blurred vision. Blurred vision. Halos around the eyes. Halos around the eyes. Halos around the lights. Halos around the lights. Halos around the lights. We're going to correct that. It's halos around lights, not eyes. Halos around lights, not eyes. Halos around lights. Closed ankle glaucoma. Halo around lights. Halos around lights. Halos around lights. Reddened sclera. A reddened sclera. A reddened sclera. Here's a cool chicken tip. Having glaucoma is like seeing God, i.e. halos. Having glaucoma is like seeing God, i.e. halos. And there it is for glaucoma. We're now going to go on to muscular degeneration. Muscular degeneration, which is deterioration of the macula resulting in loss of central vision. There's two, there's dry and there's wet. Dry macula gets thinner with age and tiny clumps of protein. Dry macula gets thinner with age and tiny clumps of protein. Dry macula gets thinner with age and tiny clumps of protein. More common, and it's a slower onset. More common, and it's a slower onset. More common, and it's a slower onset. Wet macular degeneration, which is abnormal blood vessels grow under the retina. Abnormal blood vessels grow under the retina. Abnormal blood vessels grow under the retina and leak blood fluid. Leak blood fluid. Leak blood fluid, which causes scarring of the macula. This causes scarring of the macula. This causes scarring of the macula, which is less common, faster onset. Less common, faster onset. Less common, faster onset. Signs and symptoms: loss of central vision. Very important. Loss of central vision. Loss of central vision. Blurred vision. Blurred vision. Blurred vision. We're going to go on now to spinal cord injuries. Spinal cord trauma due to hyperextension, hyperflexion, vertical compression, or rotational forces. And then you're going to have, for spinal cord injuries, degrees of injury. Complete. The damage results in loss of all innervation below the level of injury. Complete. The damage results in loss of all innervation below the level of injury. Complete. The damage results in loss of all innervation below the level of injury. Incomplete. Preservation of some function below the level of injury. Incomplete. Preservation of some function below the level of injury. Incomplete. Preservation of some function below the level of injury. Level of injury. Paraplegia. Result of injury below T1. Paralysis or paresis. Weakness of lower extremities. Paraplegia. Result of injury below T1. Paralysis or paresis. Weakness of lower extremities. Paraplegia, results of injury below T1. Paralysis or paresis, weakness of lower extremities. Quadriplegia, it's injury of the cervical region. Injury of the cervical region. Injury of the cervical region. Paralysis or paresis of all four extremities. Paralysis or paresis of all four extremities. Paralysis or paresis of all four extremities. Being that you don't have the capacity to see the level of injury and extensive paralysis, but I'm going to read it to you and hopefully you'll understand it. A C4 injury is by the 7 cervical vertebrae. So that's like the upper, like when you have right, there's your head and then there's like the beginning of the neck. That's where the C4 injury is, or the 7 cervical vertebrae. And then it looks like right when you get to the neck, which would be a C6 injury, which is the 12th thoracic vertebrae. And then when you have like down towards the bottom of the back of the spine, which is T6, where T6 injury would be, and that's the 5 lumbar vertebrae. And feel free to go on Google and look up the level of injury and extent, or you can go ahead and purchase Level Up RN flashcards, which is where my information comes from. And then you have, last but not least, an L1 injury, which is the 5 sacral vertebrae. That's towards the bottom. It's right on the bottom, right by the butt. And then, of course, the 4 coccyx vertebrae is there too. It's like that little tail end. So go ahead and look at that. So we just went over spinal cord injury, the level of injury, and the illustration that I invited you. But we're going to go ahead and go over signs and symptoms, which is important. Signs and symptoms: decrease in motor function, decrease in motor function, decrease in motor function, decrease in sensation, decrease in sensation, decrease in sensation, loss of bowel bladder control, 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 respiratory dysfunction, especially injuries above C4. Respiratory dysfunction, especially for injuries above C4. Respiratory dysfunction, especially injuries above C4. Hypertonia, results of injury to upper motor neurons. Hypertonia, results of injury to upper motor neurons. Hypertonia, results of injury to upper motor neurons. Spastic muscle tone, spastic muscle tone, spastic muscle tone, spastic neurogenic bladder, spastic neurogenic bladder, spastic neurogenic bladder. Hypotonia, 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 results of injury to lower motor neurons, results of injury to lower motor neurons, results of injury to lower motor neurons. Flaccid muscle tone, flaccid muscle tone, flaccid muscle tone, flaccid neurogenic bladder, flaccid neurogenic bladder, flaccid neurogenic bladder. And here is something very important that you need to know. Spinal shock may occur following a severe CSI. This causes a temporary loss of reflexes and sensation, lack of thermoregulation, and flaccid paralysis below level of injury. That's spinal shock may occur following a severe SCI. This causes a temporary loss of flexion and sensation, lack of thermoregulation, and flaccid paralysis below the level of injury. And again, spinal shock. It occurs following a severe SCI. It causes a temporary loss of reflexes and sensation, lack of thermoregulation, and flaccid paralysis below the level of injury. For nursing care for the spinal cord injury, SCI, this is important. Stabilize the spine, maintain airway. Stabilize the spine, maintain airway. Stabilize the spine, maintain airway. Monitor vital signs. Monitor vital signs. Monitor vital signs. Monitor for complications. Monitor for complications. Monitor for complications. They include hemorrhage, neurogenic shock, autonomic dysreflexia. Hemorrhage, neurogenic shock, autonomic dysreflexia. Hemorrhage, neurogenic shock, autonomic dysreflexia. Provide urinary catheterization. Provide urinary catheterization. Provide urinary catheterization. Initiate bowel program. Initiate bowel program. Initiate bowel program. That's an example: stool softeners and toileting schedule. Reposition patient regularly to prevent pressure injuries. Reposition patient regularly to prevent pressure injuries. Reposition patient regularly to prevent pressure injuries. For a patient in halo traction, do not apply pressure to rods. Do not apply pressure to rods. Do not apply pressure to rods. Make sure wrench and screwdriver are attached to the vest. Make sure wrench and screwdriver are attached to the vest. Make sure wrench and screwdriver are attached to the vest. This will release the patient from the device in the event of an emergency. Now we're going to go on to neurogenic shock, which is an autonomic dysregulation following a spinal cord injury, typically above T6. Signs and symptoms: hypotension, bradycardia, flushed warm skin. Signs and symptoms: hypotension, bradycardia, flushed warm skin. Signs and symptoms: hypotension, bradycardia, flushed warm skin. Now we're going to go on to autonomic dysreflexia. It's a life-threatening hypertension following a spinal cord injury, and it's typically above T6. Signs and symptoms, this is very important: extreme hypertension, extreme hypertension, extreme hypertension, severe headache, blurred vision, severe headache, blurred vision, severe headache, blurred vision, diaphoresis, 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 flushing above level of injury, flushing above level of injury, flushing above level of injury due to vasodilation, due to vasodilation, due to vasodilation, cool pale skin below level of injury, cool pale skin before level of injury, below level of injury, cool pale skin below level of injury, cool pale skin below level of injury, and this is due to vasoconstriction, vasoconstriction, vasoconstriction. Nursing considerations: first priority is to sit the patient up. Sit the patient up, sit the patient up. This is the first priority. Sit the patient up. Notify the provider. Notify the provider. Notify the provider. Loosen restrictive clothing. Loosen restrictive clothing. Loosen restrictive clothing. This is important. Loosen restrictive clothing. And more important, address underlying cause. Address underlying cause. Address underlying cause. For treatments of this, you're going to do antihypertensives. So when you're addressing the underlying causes, there could be distended bladder and fecal impaction. This is important. Distended bladder, fecal impaction. Distended bladder, fecal impaction. Again, administer antihypertensives and monitor blood pressure. Monitor blood pressure. Monitor blood pressure. We're going to go on to multiple sclerosis. It's an autoimmune disorder that causes the development of plaques in the white matter of the central nervous system, categorized by periods of relapsing and remitting. Relapsing and remitting. Relapsing and remitting. That's important. Risk factors: female, age 20 to 40. Risk factors: female, age 20 to 40. Risk factor: females, age 20 to 40. Signs and symptoms: vision problems, diplopia, and nystagmus. Vision problems, diplopia, and nystagmus. Vision problems, diplopia, and nystagmus. Muscle spasticity and weakness. Muscle spasticity and weakness. Muscle spasticity and weakness. Hearing loss, balance issues. Hearing loss, balance issues. Hearing loss, balance issues. Bladder, bowel dysfunction. Bladder, bowel dysfunction. Bladder, bowel dysfunction. Cognitive changes, fatigue. Cognitive changes, fatigue. Cognitive changes, fatigue. Emotional changes, depression, pain, dysphagia. Emotional changes, depression, pain, dysphagia. Emotional changes, depression, pain, dysphagia. Patient teaching: avoid triggers that may worsen symptoms. Avoid triggers that may worsen symptoms. Avoid triggers that may worsen symptoms, which is temperature extremes, stress, fatigue, illness. temperature extremes, stress, fatigue, illness. Temperature extremes, stress, fatigue, illness. The next one we're going to go to is amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis. Neurodegenerative disease causing progressive muscle weakness. Neurodegenerative disease causing progressive muscle weakness. Neurodegenerative disease causing progressive muscle weakness. Cognitive function is not impacted. Cognitive function is not impacted. Cognitive function is not impacted. Signs and symptoms: muscle weakness and atrophy. Muscle weakness and atrophy. Muscle weakness and atrophy. Muscle cramps and twitching. Muscle cramps and twitching. Muscle cramps and twitching. Dysphagia. 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 This is important. Respiratory paralysis within 3 to 5 years. Respiratory paralysis within 3 to 5 years. Respiratory paralysis within 3 to 5 years. Here's a nursing condition or consideration. Number 1, maintain patent airway. Maintain patent airway. Maintain patent airway. Monitor for pneumonia and respiratory failure. Monitor for pneumonia and respiratory failure. Monitor for pneumonia and respiratory failure. Coordinate with palliative team. Coordinate with palliative team. Coordinate with palliative team. We're going to now go on to Guillain-Barré syndrome, which is GBS, Guillain-Barré syndrome. It's an autoimmune disorder affecting the peripheral nervous system that causes a sudden onset of weakness and paralysis. Signs and symptoms: tinglings in hands and feet. Tingling in hands and feet. Tingling in hands and feet. Signs and symptoms: symmetrical weakness, which is important. Symmetrical weakness. Symmetrical weakness. Absent deep tendon reflexes. Absent deep tendon reflexes. Absent deep tendon reflexes. Paralysis. 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 And this is important. Symptoms begin at the feet and move up. Symptoms begin at the feet and move up. Symptoms begin at the feet and move up. Nursing consideration: patent airway. 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 Aspiration, pneumonia, respiratory failure. Aspiration, pneumonia, respiratory failure. Aspiration, pneumonia, respiratory failure. This is where your ABCs come in. You are monitoring and you're going to maintain a patent airway, and you're going to monitor for aspiration, pneumonia, and respiratory failure. The next we're going to go through is the myasthenia gravis, which is an autoimmune disorder that causes severe muscle weakness characterized by periods of exacerbation and remission. Signs and symptoms: muscle weakness. Muscle weakness. Muscle weakness. It becomes worse with activity and improves with rest. Worse with activity, improves with rest. Worse with activity, improves with rest. Diplopia and dysphagia. Diplopia and dysphagia. Diplopia and dysphagia. You're going to have shortness of breath. Shortness of breath. Shortness of breath. Thymus hyperplasia. Thymus hyperplasia. Thymus hyperplasia. The important signs and symptoms for this, though, that you may see, it's very important: drooping eyelids. Drooping eyelids. Drooping eyelids. You're also going to diagnose myasthenia gravis with I'm going to butcher it. It's Edrophonium tensilin test. Edrophonium tensilin test. Edrophonium tensilin test. You're also going to monitor for cholanogenic crisis, cholanogenic crisis, cholanogenic crisis. Nursing condition or nursing considerations, you're going to maintain a patent airway. Maintain a patent airway. Maintain a patent airway. Assist with ambulation. Assist with ambulation. Assist with ambulation. Encourage periods of rest. Encourage periods of rest. Encourage periods of rest. Provide small, frequent, high-calorie meals. Provide frequent, high-calorie meals. Provide small, frequent, high-calorie meals. Monitor for choking and aspiration. Monitor for choking and aspiration. Monitor for choking and aspiration. Administer eye drops. Administer eye drops. Administer eye drops. And you're going to tape the eyes shut at night. This is very important, guys. Tape the eyes shut at night. This is a secret. Think Level Up RN. Tape the eyes shut at night. And why? To prevent coronal drying damage. Why? To prevent coronal drying damage. Why are you going to tape the eyes shut at night, guys? To prevent coronal drying damage. And we're going to go on to a next set in a few minutes. See you guys soon.